Hello, everyone. We're Team 17. My name is Sierra,
And my name's Gonzalo.
and today we'll be discussing the opioid crisis during COVID 19. I know for this assignment, we're trying to drift away from the issues regarding COVID, but I believe that this topic deserves more attention. I know during this extreme time, we're battling both the global pandemic, coronavirus, but also a substance abuse epidemic. In the article I chose, it briefly discusses the issues regarding the Sarasota County Sheriff's Office that has reported already 29 opioid deaths in the first 6 months of this year. That's more than double in all of 2019.
Um, so for my article, when I was reading the article, Opioid Crisis Thrives During a Pandemic, I was reading a quote that caught my attention. The article states that according to the American Medical Association, more than 40 states have recorded post-pandemic increases in fatal opioid cause overdoses. There can be many factors due to this, but COVID-19 is definitely a huge cause to increase of fatal opioid overdoses. The hospitals are in high demand, and there is not enough capacity for everyone during the early stages of the pandemic. These are very hard times for people, especially when suffering from opioid addiction. This will be an ongoing epidemic if it is not taken seriously by our government officials.
The importance of this topic is to inform us about the increased death rates and near fatal accidents corresponding to opioid use. This affects us all on a personal level when we've heard that we've lost a loved one, a movie star, or a song artist due to a drug overdose, especially when these rates are increasing by more than 50% in a 6 month period. Lack of support is important to add with this issue because if you don't already know, isolation has been the main trigger for those who suffer from substance abuse disorders. Decreasing access to proper healthcare goes hand in hand with this too. I know during COVID 19, it's made it more difficult to attend therapy sessions or social gatherings to help those with substance abuse disorders due to the new stay at home regulations. And with all this free time, it eventually can lead to fatal accidents. So, who's impacted by this issue? Families of individuals who suffer from substance abuse disorders are greatly affected because of the availability of the drug. Because of COVID, families are always at home, and the chances of a child getting into something they shouldn't increases during this time. Lower income communities are also largely affected by this issue due to the black market drugs. Overprescribed opioids are hitting the streets, which result into unsafe use. Healthcare systems have reported delayed time due to new COVID procedures, which can result into more deaths due to time wasted for these precautions. And I know going into college, we are exposed to many different experiences, and for some of us, drugs is one of them. So we should take this knowledge about the skyrocketing increased rates of deaths due to opioid overdose during COVID and apply it to our lives by educating ourselves on the topic of drug abuse and collectively finding ways to prevent these fatal tragedies.
How this correlates with public health. The socio-ecological model, from the individual level, motivation can be lacking. This can make it harder for a person to start their day. Personal growth is also affected by an opioid addiction. Mental health is drastically affected by addiction and also intellectual abilities. Individuals involved with construction occupations suffer from the highest rate of opioid overdose. From the interpersonal level, family and friends are affected by the user's opioid addiction, mostly mentally. A family history of substance use disorder can influence opioid through both genetic and environmental factors. From an organizational level, hospitals are overpopulated due to the pandemic and the epidemic. Also, hospital response times for an opioid overdose have been longer due to COVID-19. Communities such as schools and parks are being littered with drugs and syringes. The community is also affected by homelessness due to opioid addiction. In policy, access to health insurance is huge for the opioid addiction. The number of people who have health insurance coverage varies by state and has implications for access to opioid use disorder treatment. Overprescription was influenced by pharmaceutical marketing campaigns that falsely marketed opioids as non-addictive. These incentives towards the doctors included sponsored meals, travel expenses, and education. And that is it. Thank you.
All right.